Our state lab has been testing for the new coronavirus, and today we have confirmed our first presumptive positive results for the new coronavirus in North Carolina.
That was Governor Roy Cooper delivering updates in a COVID-19 task force meeting 2 years ago today when North Carolina learned of its first COVID-19 case. The governor says the person from Wake County was exposed to the virus while traveling to Washington State. Even before that day, COVID-19 started to pop up in major cities along East and West Coasts.
Well, here in North Carolina, 2 years ago today, that was the first day the state health department confirmed the virus was here.
I know people are worried about this virus, and I want to assure you that the state of North Carolina is prepared. Our most important work is keeping people healthy and safe.
Well, as you remember, COVID quickly spread, changing nearly every aspect of our everyday lives. Work went remote, school went remote, family gatherings started being canceled or held via Zoom.
To return to in-person instruction right now appears to us to be a very dangerous proposition.
We live in an area that does not have internet access, so we are working strictly off of our mobile phone hotspots, and we get 1 bar of signal.
Families with loved ones battling the virus were limited in communication since hospital visitation was closed off. Their hope being their brother, sister, cousin, aunt was to beat the virus. A sign of hope emerged last year when COVID-19 vaccines became available, providing additional protection against the virus. Health leaders encouraged everyone to find their spot to take their shot. As access expanded, we began to hear more about hesitancy to take the vaccine.
The Bible says faith without works is void. So we need to have faith, and we also need to work to protect ourselves. And we learned that lesson.
Miracle Wilson lost her husband, Reverend Kermit Wilson Jr., late last year to COVID. Wilson says her husband was unvaccinated. She turned her pain into purpose by hosting a vaccine clinic at their church.
Well, these last 2 years have been hard. We have lost a lot. We've lost loved ones, but we've also seen some hope over the last 2 years. Last April, Kenneth Cecil was released from Novant Health after spending 108 days in a hospital.
The stronger I got, the more hope I had of getting out of here. I never lost hope because I'm strong in the faith, and I knew who had brought me this far. And then Dr. Tarter there had been behind me 1,000%, and he's pushed me. And he had an agenda to get me home as well as I had one to get home.
Standing strong in his faith. Well, now he needs a double lung transplant due to all the damage that COVID caused, but he is hopeful that surgery will happen soon. We're going to continue to keep those families in our prayers, and everyone who's gone through COVID, who has these long-term effects that we're seeing. It is amazing how one virus has really destroyed so many lives.
And we say thank you to the frontline workers still working around the clock to send patients home to their families. And while it has been 2 years, COVID-19 is still very real, working for those in hospitals. As they keep treating patients, they remember the roller coaster the virus has taken us through.
Let's check in with WFMY News 2's Itanise McMiller. Itanise, you've been talking with nurses who are reflecting on the last 2 years and all that they've been through and all they've seen. I can't imagine the stories that they've shared with you.
Yeah, it was interesting speaking with nurses from different healthcare systems, because no matter if they worked for Moses Cone here in Greensboro or in Winston-Salem with Novant Health, they all said the same thing. 2 years in, and they say adjustments are still being made.
And just being flexible as, our stuff changes. One day it's this, the next day it might change. And we try to do the best that we can do to keep up with the latest and greatest that comes out.
Moses Cone RN April Lewis says that's what it's like for her working in healthcare today. 2 years ago, we knew little about the pandemic and this virus, but Lewis says all she cared about was taking care of her patients.
Nursing is hard pre-pandemic, during, post. It got worse during the pandemic, but just remembering that, you're only one person and you can only, you have to help yourself first before you can help your patients. So just remembering that and still making those connections with your patients when you are there to make it, as meaningful as you can.
Panisa Caldwell's role with Novant Health completely shifted from administrative duties overseeing Novant's more than 700 clinics to being double masked and in full PPE at churches and schools across the Triad. Despite the pain the pandemic has brought, Caldwell says there is some good to take away from it all.
So now some of our patients in the communities we work with, they tell us things. So we have done a great job listening to them and also educating them, because you see a lot who has been vaccinated. I feel great. We have accomplished a lot in 2 years.
Now back out here live at Moses Cone, Lewis tells me that they have had COVID patients come in months ago that have not left. They are still in their COVID unit. So there is still some work to be done. Right now, Cone Health has about 84 patients in their COVID units.